I'm ready, ma'am.
Okay, so if you've read and understood, considering it surgical and not mistician, please tell me. Right, what would be the provisional diagnosis of the condition with which patient is suffering from?
Ma'am, cognitive dysfunction and impaired memory could be due to normal pressure hydrocephalus or dementia.
Can't just say dementia. There must be something in this age group. Okay, we can come back to this and we'll discuss this, but there needs to be more than yes reason for that. Okay, if you could if you could describe what kind of image you are looking at, please.
This is a sagittal view MRI or
Yes.
T2 weighted image.
Right, very good. Would you be able to identify a few structures for me? Like, I want you to identify number 16.
Number 16. Yes. This is the medulla.
Oblongata. Okay. And if you could identify number 9.
Is cerebellum.
Okay, very good. If you could identify number 4.
Number 4.
Where is 4?
Yes. It's
It's here.
interpeduncular system.
No, aqueduct of Sylvius. Okay,
Aqueduct of Sirius. Yes.
see, if you could identify number 5, please, for me.
It's basilar artery.
Right, if you could identify number 11, please.
11 is cervical cord, spinal cord.
Cervical spinal cord, very good. Okay, since I asked you to identify number 4, please tell me the circulation of CSF, cerebrospinal fluid.
Yes, there are two lateral ventricles, and the CSF flows from lateral ventricles through the foramen of Monroe to the third ventricle, and then from the third ventricle uh, through the aqueduct of Sylvius into the fourth ventricle. Fourth ventricle has two lateral apertures of foramen Luschka and one median aperture of Magendie through which the CSF passes to the subarachnoid spaces and the spinal cord, and also through these subarachnoid spaces, CSF returns to the sinuses and get reabsorbed in the arachnoid
Good.
villi.
Please tell me, right, if you could tell me, if you could identify subarachnoid space or the cisterns here, would you be able to in this image?
Yes, ma'am.
Where exactly can you point it?
On above 17 is suprasellar system. Then above 4 here is interpeduncular system, and in front of pons is the prepontine cistern, and then there is cisterna magna at 13.
Okay, good. Right. Which one is the largest?
Cisterna magna is the
Very good.
largest.
Okay. Right. If you could wait it. Okay. Right. Or you told me all the systems. What is cerebellar vermis and tonsils?
Yes, this is the part of lower part of cerebellum here behind the pons and the fourth ventricle, and during and there is a herniation related to that if there is raised ICP or if patient have an
No abbreviation. Raised intracranial pressure and
intracranial pressure or if patient have Arnold Chiari malformation, the cerebellar
right.
tonsil
My next
herniates.
question is what is Arnold Chiari malformations?
It is the descent of the cerebellar tonsil into the through the foramen magnum into the spinal canal.
Right, resulting in hydrocephalus.
Hydrocephalus, yes,
And
non-communicating.
and yes, non-communicating and obstruction of cerebrospinal fluid. Please, one more thing. What would you see in that condition? What would you see in MRI? How
In
MRI
MRI,
will be different? Yes.
MRI, there would be small posterior fossa. There would be flattening of brainstem or the knuckling of brainstem. There would be hydrocephalus, enlarged ventricles, and there would also be descent of cerebellar tonsil into the
Right.
spinal.
Please tell me what is tentorium cerebelli?
Tentorium cerebelli is dural thickening uh, that connects to the falx cerebri anteriorly,
Yes.
and posteriorly it divides posterior fossa from the occipital lobe.
Okay. Right. Please tell me what are the cranial nerves which carry parasympathetic fibers?
Yes, it's oculomotor, facial, glossopharyngeal, and vagus.
Okay. If you could, right. Yes, that I cannot because I haven't shown you. Okay, I want to ask about if you could tell me about the tumors in the okay. All right, let's talk about the blood supply of the brain. Please tell me.
Yeah. Yes, two internal carotids and two vertebral arteries meet in the base of the skull and form circle of Willis. The internal carotid artery gives anterior communicating, anterior cerebral, and middle cerebral arteries, posterior communicating arteries that supply internal capsule uh, uh, and the striatum and thalamus. Then the branches of two vertebral artery converge to form basilar artery that connects with the posterior communicating artery and forms the circle of Willis. And they give different branches. Vertebral artery in the posterior fossa gives posterior inferior cerebellar artery, and basilar artery gives anterior inferior cerebellar, labyrinthine, pontine arteries, and superior
All
cerebellar
right, good,
arteries.
thank you. Please tell me what you understand by the term subclavian steal syndrome.
Yes, if there is any tumor of the thoracic outlet, it may compress the subclavian artery and cause uh, uh, hypoperfusion of the upper limbs uh, that may cause ischemia or pain or numbness of the upper limbs.
Okay, can you please tell me? Right, I have lost the question. Okay, if you could tell me the difference between upper motor neuron lesion and lower motor neuron lesion in case of facial palsy.
Yes, in upper motor neuron, the forehead muscle is spared, and in the lower motor neuron, the forehead is involved. In upper motor neuron, there would be weakness of the contralateral side of the lower face, but in lower motor neuron lesion, there would be ipsilateral weakness of both lower and upper face.
Okay, right. Since you wanted to cover the whole head and neck, right. In case of middle ear, please tell me the medial wall relations.
Yes, medial wall is formed by uh, the tympanic cavity, and there is also superiorly the epitympanic recess.
Okay, there should be a little bit more. Right. Okay, right. Tell me, internal carotid artery gives one branch before it enters the skull. What is the name of the branch?
That is the ophthalmic artery, the first branch of internal.
Okay, right. All right. Yes. It's okay. Uh, what is Barry's aneurysm?
Aneurysm is the aneurysm of circle of Willis.
Wait. It was also called subarachnoid hemorrhage, and it's the rupture of middle meningeal, middle, yeah, MCA. What are the signs with which a patient presents which has barrienosrhythm rupture?
Patient will have severe headache, and patient will have signs of meningism like neck rigidity and positive Kerning or Brodowski signs. Patient will have also raised ICP, vomiting, and decreased consciousness.
Okay, infarct, basically MCA infarct will result in, it's a kind
Yes,
of stroke.
MCA infarct will present with aphasia if the dominant side is involved. Patient will have contralateral hemiplegia, and patient will also have contralateral hemiplegia of the lower part of the face.
Good, thank you.
Thank you, ma'am.